What is the correct order of the normal phases of wound healing? Hemostatic phase, inflammatory phase, proliferative phase, remodeling phase. All of the following are risk factors for an increased risk of wound infection except hypertension. Systemic inflammatory response syndrome SIRS is characterized by all of the following except platelet count less than 1 lakh per cubic millimeter. Gentleman of 56 years underwent laparoscopic left hemicolectomy for diagnosed left colonic carcinoma. Histopathology revealed the tumor to be invading submucosa and muscularis propria. Among the 16 regional lymph node harvested, 2 were positive for malignant deposits. His staging as per AJCC will be T2N1M0. All of the following are hormonal agents used in treatment of cancer except irinotecan. Which of the following statements regarding lymphoedema are correct? Patient experience constant dull ache and even severe pain sometimes. Manual lymphatic drainage has a role. Primary lymphoedema is caused by congenital lymphatic dysplasia. Non-Milroy's disease is a type of primary lymphoedema. All 1, 2, 3, 4 are correct. Indication for carotid endarterectomy in symptomatic patients are all of the following except persistent hypertension. A policeman of 45 years present with lipodermatosclerosis over lower medial aspect of left leg along with a healed venous ulcer as per the CHEAP clinical etiology, anatomy, pathophysiology classification. His classification will be C5. Healed venous ulcer C5. What is true about the management of corrosive injury of esophagus? Early skilled endoscopy is must. Which of the statements regarding salivary gland neoplasm are correct? 90% of sublingual gland tumors are malignant. 60 to 70% of submandibular gland tumors are benign. Parotid gland is most common site for salivary gland tumors. A few days following viral fever, 50-year-old female present with pain in neck, fever, malaise, and firm enlargement of both the lobes of thyroid. On investigation, thyroid antibodies were normal and serum T4 was higher than normal. Probable diagnosis is granulomatous thyroiditis. No increased relative risk of invasive breast carcinoma based on histopathological examination of benign breast tissue is for all of the following except solitary papilloma of lactiferous sinus. Which of the following statements regarding Paget's disease of nipple are correct? Is eczema-like condition of nipple and areola. Erosion of nipple is seen. Nipple biopsy is required for definitive diagnosis. A gentleman of 36 years presented with a long history of upper abdominal pain which was periodic and often occurred early morning. For last 3 months, he is having projectile vomiting which is non-bilious, unpleasant in nature with undigested food materials. On examination, he appears unwell, dehydrated and seemed to have lost weight. Probably he is suffering from gastric outlet obstruction. A 40-year-old female patient with cloaky abdominal pain associated with episodes of mild diarrhea for last 6 months accompanied with intermittent fever and weight loss. There are multiple discharging sinuses on perineal examination. The most likely clinical diagnosis in this patient is Crohn's disease. A gentleman of 48 years was being worked up for hepatocellular function. He had no history or sign of encephalopathy. His serum bilirubin was 5 mg%. Serum albumin was 3.9 gram%. International normalized ratio was 1.6. On ultrasound, no free fluid was detected inside abdomen. As per Child Turcot Pugh CTP classification, he was in CTP B. Which of the statements regarding Callot's triangle are correct? Common hepatic duct forms the middle boundary of the Callot's triangle. Inferior surface of the right lobe of the liver forms the superior boundary of Callot's triangle. Cystic duct and medial border of gallbladder forms the lateral border of Callot's triangle. Consider the following statements regarding opportunistic post-splenectomy infection OPSI. The correct statements are Haemophilus influenzae, Neisseria meningitis, and Streptococcus pneumonia are the most common causative agents. Risk is the greatest within the first 2-3 years following splenectomy. Prophylactic vaccination should be done 2 weeks prior to elective splenectomy. A 48-year-old male with a history of chronic duodenal ulcer presented in surgical emergency with the complaints of sudden severe pain in the abdomen. At presentation, pulse 120 per minute, BP 90 by 60 mm of Hg, abdomen tenderness, rigidity, guarding positive, respiratory rate 20 per minute, X-ray, gas under right dome of diaphragm. The probable diagnosis is perforation peritonitis. A young sports person presented in surgical emergency with complaints of severe pain in the groin area extending into the scrotum and upper thigh. The pain is deliberating and he is not able to exercise. On examination, there is tenderness in the region of inguinal canal and pubic tubercle. He is probably suffering from sportsman's hernia. Ventral hernia includes all except inguinal hernia. Diaphragmatic injury is suspected in a 50-year gentleman with history of blunt abdominal trauma. Having a normal chest X-ray, he is best managed by diagnostic laparoscopy. 20-year-old man had history of pain in the right side of abdomen. His X-ray abdomen AP view shows radio-opaque shadow, which on lateral film fall behind the vertebral column. The probable diagnosis is renal calculus. Urinary bladder can be injured in all of the following operations except inguinal lymph node dissection. In diffuse axonal injury, all are true except CT scan shows pathognomic finding. 70 years old man on anticoagulants due to some heart disease suffered a minor head injury. 1 month later, he had severe headache with slow developing neurological signs. The probable diagnosis is chronic subdural hematoma. Regarding quinsy, all of the following are correct except pus may be seen pointing underneath the thin mucosa in all cases and is diagnostic. The most common organism causing acute otitis media in children is Streptococcus pneumoniae. A 50-year-old male present with pain along the left arm and ptosis. His chest X-ray showed soft tissue opacity at the apex of left lung, along with the erosion of the adjacent rib. The probable diagnosis is Pancoast lung. Which of the following is not true about Dupuytren contracture? Not familial.